Good afternoon. I am Dr. Sriganesh. Today I have with me my daughters, Dr. Supriya Sriganesh and Dr. Sushmitha Sriganesh. And we have been using the Sophi and the Sophi A machines now for over a year. And we would like to present some very nice cases on the Sophi. It's got active fluidics. It's got two peristaltic pumps, one for irrigation and one for aspiration. And it's also got a venturi for aspiration. So it's got an irrigation sensor which is constantly monitoring the IOP and compensating for any fluctuation. I use the forceps to grab the flap and gently kind of complete the rhexis so that I remove any tissue bridges, and I put in a little HPMC at the wound to reduce the incidence of any wound burn. That's the Phaco tip being inserted. So again here I'm using a straight tip. So with the Sophi you can either use the flange tip or the regular straight tip. You can see that I'm using the burst mode on the Sophi to bury and impale the nucleus, so I get a good purchase on the nucleus, and I'm using a sharp chopper to split the nucleus. So there I've split the nucleus into two. I rotate the nucleus, again bury. You can see that the chamber is extremely stable, and once I get that quadrant into the safe zone, which is the center of the AC at the pupillary plane, then I'm able to use pulse mode and then very easily aspirate and remove the cataract. Here I'm using a flow of 50 cc's per minute and a vacuum of 500 millimeters of mercury in the vacuum mode, the venturi mode. So it's very efficient. You can see that you have a nice followability of the fragment. So the Sophi is able to kind of manage even these very complex, dense cataracts with ease, and the best part of it is the chamber stability and the efficiency with which the Phaco is delivered. And sometimes this very flimsy and thin cortex, it may be difficult to aspirate, but in the vacuum mode you have control over the vacuum and you're able to nicely evacuate even those small frills of cortex which are sticking there. So again I'm cleaning the capsular bag, and you can see those small remnants of cortex are flushed out with the 27 gauge cannula. These cases you have some sticky cortex at the sub-incisional area, so you can go through the side port and just flush it out so that you have a clean bag, and this reduces the incidence of PCO in these cases. You don't have any wound burn because the energy delivery with the Sophi is very smooth. Even the pulses are kind of chamfered, so you have very good energy delivery but very less heat production.
I didn't plan on using any pupil expansion rings because it was a 5 mm pupil and I was able to do a good rhexis along the 5 mm pupil. Here I go in with the Phaco machine very deep and I'm able to do direct chop. As you can see here, it's pretty easy for me to make the 4 quadrants, and the IOP is well maintained, which helps keep the pupil at a good size for me to visualize, and then bring in the pieces into the center with the help of the vacuum and then heat it up. Yeah, it's not a very dense cataract, but it was a mid-dilating pupil. Again, there's not much fluctuation in the anterior chamber. The pupil size is well maintained for me to be able to complete the Phaco emulsification. I go in, complete the cortical removal with the bimanual technique, wash out a little bit. I'm able to visualize the rhexis margin as well, and then complete the cortical removal. I go ahead and inject the monofocal IOL that was planned, and then do a thorough wash of the anterior chamber. So as you can see here, there's a little bit of an iris prolapse. So I go hydrate the main incision a little so that it doesn't allow for the iris to prolapse again. Complete the visco washout with the bimanual eye. There's a little bit of cortical material behind the IOL because but because I'm confident, I just go behind the eye, I'll wash it out, and then I'm done with the case. I do the capsulotomy with a cystotome, get a good hydrodissection there, and the nucleus is freely rotating. Here I'm using a bent tip with the Sophi and a 19 gauge sleeve, and you can actually see my Phaco settings. As I bury, it's going up to more than 500 vacuum at full occlusion, and I get a good through and through chop there. So it's the hold on the pieces is quite excellent. The bent tip also really helps in dense cataracts to get deep into the right sweet spot, and when you chop and hold it, the vacuum goes up, and even at 500 plus vacuum, the chamber is rock solid. I'm switching to Phaco 2 here, which is again a high vacuum mode. You can see I'm in the center, bringing the pieces to the safe zone and using my left hand with my chopper there to just gently feed the pieces into the probe. But the probe does the majority of the work of just aspirating even a dense cataract like this really easily. The followability is also pretty good. I'm just at the center, and my Phaco power itself is not all that high. I'm at about 20 to 30% Phaco and keeping it stable at that level. And the pieces just come to you. I'm not having to come out and fill the chamber with viscoelastic multiple times. There's no wound burn, everything looks fairly stable, and I'm not having to use too much Phaco energy to remove even a dense cataract like this.
Thank you very much for joining me today, and we enjoyed sharing our experiences with the Sophi, different techniques, different parameters. Thank you very much.